And finally, we're going to circle back to where we started with coronavirus fatigue. There's an interesting article in the Washington Post about how people are becoming numb to the risks of COVID-19 as the pandemic wears on. Essentially, the longer people go without being infected, the more they're willing to push their boundaries. So, Mike, how should people be evaluating their individual level of risk?
First of all, we will link to this article on the website for the podcast. I urge everyone to read it. It's by Elizabeth Svoboda, an author that I very much appreciate and have read her books. Elizabeth is someone who has written for a number of different publications. But where I first really got to know about her, she wrote a wonderful book about heroism and altruism. And the title of the book, which was published in 2013, is What Makes a Hero? The Surprising Science of Selflessness. And she described what she learned along the way with that book. A remarkable book. I urge you to read it. And then in 2019, she actually did one for young heroes in training. And in this case, the title of the book is A Life Heroic, How to Unleash Your Most Amazing Self. In the August 22nd issue of the Washington Post, Elizabeth wrote an op-ed piece, How Our Brains Numb Us to COVID-19 Risks and What We Can Do About It. And as you said, Chris, in your question, she really laid out this idea that what's happened is we're basically becoming, through what we call exposure therapy, more and more used to touching the candle. If we've gone out a little ways and have been a little risky and we're okay today, we go out a little farther the next time. And in a sense, it's this whole issue of perception of risk and where we're at. And, you know, when as she said in here, for example, with parties, when you do the right thing and stay home and don't go to a big party, you feel an immediate cost. You're not able to be with your friends. So when you go to that party and you don't have anything bad happen, you just reinforce, well, that was unnecessary anyway, until, of course, that next one is what nails you. And she actually said, and I quote, because risk perception fails as we learn to live with COVID-19, researchers are calling for the renewal of tough government mandates to curb the virus spread. Now, you know, that's what I said back in the issue with the op-ed piece in the New York Times several weeks ago. And I think that is a challenge today, that these measures aren't going to work because people don't want them. But we have to understand we are, in fact, becoming numb to this. And so we just say, let's move on. I don't think it's going to be real until it happens to you. And, you know, I surely don't want to, you know, tread on anyone's life right now and sensitivities. But, you know, I had someone say to me in a conversation that they have internalized this COVID risk in a very personal way, in that they actually had a family member, a loved one, who was killed by a drunk driver. And they said, you know, as many years as I always heard about that, I saw the billboards, it never meant anything to me until it happened. And now it means everything to me. I think every day about how can I help reduce the risk of that happening. And what we don't want to have happen here is that we find ourselves becoming champions of reducing the risk of acquiring this virus and this pandemic because we had to get there because of a loss of a loved one or a severe illness. And I think this article really will help give you a sense of that and what it's about. So I urge you to take a look at it if you get a chance. Elizabeth's an incredible writer, very, very, very thoughtful.